Good morning, everyone. My name is Kara Canuck, and I am one of the co-owners of Des Moines Mom. And we are joined today with Dr. Andrew Sims. He is a pediatrician with Blank Children's Pediatrics, and we are talking on the topic of sun safety, which is super timely because it is hot, it is sunny, and people want to be outside after a very long winter. And so I think, there's lots that we're going to cover here. Dr. Sims, can you tell me a little bit about yourself professionally and personally?
Yeah, hi. So I am a pediatrician and I work downtown in the Blank Pediatric Clinic, which is attached to the hospital there downtown. And I've been a pediatrician since 2018, and I was trained here locally at Blank at their residency program. And my family and I have kind of fallen in love with Des Moines over the last more than a decade now. I got a 7-year-old, a 4-year-old, and a 11-month-old. So a
Okay.
lot of active sun safety participants.
Great. You are right in the thick of things, and you can speak both from a personal experience as well as a professional experience when it comes to sun safety. So let's just kind of dive right in. As we are, trying to keep our kids from getting sunburns and keeping them safe out in the sun, um, we are looking at sunscreen and all the different options there. Can you walk me through kind of what the different what's the difference between like a mineral-based sunscreen and a different sunscreen?
Yeah, so the main two mineral sunscreens that you're going to see are going to be based on either a titanium dioxide or a zinc oxide, and they're exactly that. They're minerals. They don't generally get kind of absorbed further into the skin, so it's almost more of a physical block that it's having on your skin, and a lot of them you're going to see on the skin. Um, the other are different types of chemicals that are going to get absorbed a little bit more. They've done a lot of testing as far as how it is, I guess, the long-term safety. But depending on what they are, they're going to have their own drawbacks or kind of benefits that they're a little bit easier either to apply or cosmetically the people are liking them. And they all kind of have the same goal where we are blocking the different rays of the sun that over time are going to put us at risk for skin cancer.
Okay. What is like the minimum SPF you recommend for us to use?
Yeah, so the American Academy of Pediatrics would give the bottom cutoff for most kids at an SPF of 15. But if you look at the skin specialist, the American Academy of Dermatology, they say 30. And I would say that most of my patients are pretty young, and I typically am going to recommend all families to at least have an SPF of 30 that they're applying. And normally that's going to block about 97% of the kind of harmful rays.
Okay. So as I'm looking through, the sunscreen and reading the labels, and I see the term broad spectrum pop up, I don't really know what that means. Can you kind of give me a quick and dirty explanation?
Yeah, so there are different types of the sun's rays, and the main two are UVA and UVB, and each one has their own where they are reacting with the skin a little bit different way. We do want both of them to get blocked though, and so broad spectrum is just a nice way of saying it's covering against all of those different spectrum of rays.
No.
So
Okay.
you're going to want the broad spectrum type.
Okay. That sounds good. Okay. So I know growing up as a children of the 80s and the 90s, um, one, I never thought sunscreen like you really needed it. Like that was kind of an optional thing. But also, I was under the assumption like you apply it once and you're good for like the rest of the day. That is not correct. How often should we be reapplying sunscreen?
Yeah, so it seems pretty frequent, but really every 2 hours, especially when in the humidity of Iowa, we're getting a lot of sweat. Kids are running around and it's rubbing off, or they're getting swimming. And so it really will uh, wear off over that period of time. And so 2 hours is that recommendation.
Okay. What do you commonly miss spots? As a pediatrician, what should you remind us to look out for?
Yeah, so a lot of people, if they're having a hard time with having enough coverage or applying enough, remember physical things are going to be great as well. Instead of just the baseball cap, if you can get a wide brim hat that's going to go all the way around, that'll get you a little bit extra protection on your ears and the back of your neck. Uh, there's also going to be sun shirts or clothing that's going to have extra sun protection that, again, is going to lessen how much you're having to apply to some of those areas. I would say the backs of the knees are a common spot that are easy to miss and pretty easy to burn. But yeah, tips of the ears, nose, back of the neck, any of those big exposed areas that the skin's gonna be a little bit thinner as well, and it's gonna get a lot of sun over time.
Yeah. Okay. So speaking of that, that reminds me, of when you have like these little people, little kids, babies, infants, and you don't necessarily like know how to best apply and keep them safe in the sun. What are your tips for those young kiddos?
Yeah, like it's definitely a challenge when they're wiggling around a lot.
Mhm.
So the youngest of kids, when we're looking at 6 months and under,
Mhm.
really your goal is going to try to keep them out of the direct sun. So overall shades, canopies, things like that. If there's the areas that you can't protect, you try to limit how much we're having to apply, and I would try to keep it to those mineral based sunscreens. Um, for the older kids, it there are spray, there are sticks, which
Mhm.
they're sometimes nice because they're colors, so the kids kind of like the colors, and it makes it a little bit easier to
Mhm.
apply, especially if it doesn't totally blend in, which a lot of those mineral sunscreens are. You're going to see the little white streaks. The other thing that you can do is, if it's a spray, most of the issues are going to come if we're getting that inhaled, and so making sure we're putting it on our hands. If we're going to have to put it on our face, further down on the body, if we can keep that protected, it's going to be okay. But I would say generally people are not putting enough on, and so that's going to be something we want to make sure of.
Right. Didn't I hear like a shot glass is basically how much sunscreen you should be using?
Yeah, it's interesting that's definitely been the measurement that's been going around a lot these days, which it's a good thing to as far as having in people's mind, because it seems like quite a bit. They're given that for an adult, so it might be a little bit less for kids. And again, if we're looking at head to toe, or if we have some clothes on, it's probably going to range a little bit.
Yeah. Yeah, that makes sense. Okay. All right. Well, that has been very helpful. I know more than when I started today, and I hope that our viewers today also learned something and will take something away as far as sun safety for themselves and for their children.
Oh, that's great. I add
Thank you, Dr.
one more
Sims.
thing.
Oh, go ahead.
It was a lot of kids have pretty sensitive skin, and so if a family is finding that they are in that category, I would start with one of the mineral based sunscreens. They generally aren't going to be as reactive on the skin, and I would just have them try it on a small area of the skin first before lathering up and then causing a big eruption.
No, that is great advice. Thank you for chiming in with that, Dr. Sims.
Thanks for having me.
All right. Thank you, everyone. Hope you have a great day.